This video summarizes a randomized control trial led by Rachel Tuvey titled Task-Specific Training for Bicycle Riding Goals in Ambulant Children with Cerebral Palsy. Cerebral palsy, or CP, describes a group of permanent and non-progressive disorders of movement, posture, and motor function that is caused by disturbances that occurred in the developing fetal or infant brain. Strategies to engage children with CP in physical activity, such as bicycle riding, are needed to minimize the risk of poor health in adulthood. There is a paucity of evidence to guide therapists and families in training bicycle riding skills in children with CP. One approach that can be used to train bicycle riding in children with CP is task-specific training. No previous study has investigated whether task-specific training can be an effective way for children with CP to learn how to ride a bike. Therefore, the primary aim of this randomized control trial was to determine whether, in ambulant children with CP, a task-specific physiotherapist-led group training approach is more effective than a non-specific parent-led individual home program for attaining bicycle riding goals. This study, which was prospectively registered with the US National Institutes of Health, was conducted at the Monash Children's Hospital and Royal Children's Hospitals in Melbourne, Australia. Children with cerebral palsy who were 6 and up to and including 15 years of age were invited to take part in this study. Children needed to have a gross motor function classification system, or GMFCS level, of 1 or 2, which meant that they were independently ambulant. Children also had to have goals related to bicycle riding, had access to a bike and helmet, and lived in Victoria, Australia. Children were medically cleared before participation and had to have a parent or caregiver who were able to participate. Children were excluded if they had moderate to severe intellectual impairments, other developmental disabilities or conditions preventing safe participation in the study, if they were receiving botulinum neurotoxin A injections, or had musculoskeletal or any major surgery in the past 6 months before participation. Both groups underwent a 1-week intervention period during the school holidays. Physiotherapists and allied health assistants who delivered a task-specific intervention underwent 8 hours of training 3 months before the start of the trial. The intervention involved 2-hour sessions over 3 consecutive days of whole and adaptive practice of bicycle riding skills. Sessions were led by a physiotherapist and supported by an allied health assistant. Each child's program was individualized to the goals they set at the start of the trial. Training enabled repetitive, progressive, and variable practice with the amount and type of feedback guided by the child. In the 4 remaining days, children were prescribed 30 minutes of daily home practice. Physiotherapists coach parents on task-specific and safe practice at home and in the community. Sessions occurred in groups of 3 to 5 children. The training program is described in more detail in Table S1 of the online supporting information of this paper, as well as a protocol paper published in BMJ Open. The reference is at the bottom of this slide. Families allocated to the parent-led home group or comparison group received written information on bicycle riding, safety considerations, bicycle and helmet fitting, and suggested practice locations. Parents and caregivers were asked to spend 30 to 45 minutes a day during the intervention period towards their child's bicycle riding goals. No specific training methods were provided to parents in this group. The primary outcome was defined as the attainment of at least one goal to an expected or greater than expected level at 1 week following the start of the intervention, according to the Goal Attainment Scale, or GAS. Briefly, the GAS is a criterion reference tool that is valid and reliable in children with CP. 2 to 3 bicycle riding goals were set prior to the intervention in collaboration between the child, family, and assessor, and then 6 levels of attainment were proposed for each goal. An example is displayed on the left of this slide. The primary outcome was measured by a physiotherapist who was blind to group allocation. The study also investigated several secondary outcomes, one of which was goal attainment at 3 months post-intervention. 62 children were randomly allocated to 2 groups using computer-generated block randomization, which was stratified by site. Allocation of participants to groups were concealed using sequentially numbered opaque envelopes. Demographic and baseline characteristics were similar between groups based on age, sex, GMFCS levels, distribution and type of cerebral palsy, the presence of mild intellectual impairment, and previous bicycle riding related experience. Data was available for 90% of the children for the primary outcome of goal attainment at 1 week. All outcomes were analysed using intention to treat analysis. The study demonstrated that the odds of attaining a goal in the task-specific training group was 10.4 times that of the parent-led training group. The 95% confidence intervals revealed that the odds of attaining at least one bicycle riding goal could be as little as 2.8 times to as much as 38.6 times greater in the task-specific training group compared to the parent-led training group. The secondary outcome that looked at attainment of at least one goal at 3 months revealed that the odds of goal attainment was 4 times greater in the task-specific training group compared to the parent-led training group, with the 95% confidence interval being between 1.3 to 12.5. Therefore, the findings of this study showed that a task-specific physiotherapist-led group training program is superior to a non-specific parent-led home program for attaining bicycle riding goals in ambulant children with CP in the short term.